Hey everybody, this is Robert and welcome to Outbreak News TV. And on today's show, what I want to do is take a look at some news stories from here in the U.S. and abroad about one of the infectious diseases I find most interesting. That's rabies. And I got several stories here with some messages toward the end. And let's start out with right here in the United States. And the Centers for Disease Control and Prevention on Monday put out this report, this announcement, saying that listing a group of countries, more than 100 of them, that are considered high risk for importing dog rabies into the United States. And starting yesterday, there's a temporary suspension which prohibits the entry of dogs in the U.S. arriving from countries listed below. And the list is quite extensive. There's 100, 120, 130 countries on here. From Africa, the Americas, and the Caribbean, and Asia, and the Middle East, and Eastern Europe. And I can link to this if you want to take a look at the countries that are applicable. But this came out from the CDC yesterday. And here's a news story out of Los Angeles website, and they talk about it. It said the ban goes into effect July 14th. Douglas Kratt, president of the American Veterinary Medical Association, applauded the decision. Quote, "We want to make sure we're bringing healthy dogs into the country, especially if they are going to be pets. The ban applies to dogs coming into or returning to the country, including pets or those brought in for sale or adoption. For example, if an American couple took their dog to Belize, they wouldn't be able to bring the dog back to the U.S. unless the dog first spends 6 months in a country that is not at high risk for rabies." It says about 1 million dogs are brought into the U.S. every year, and the ban is expected to apply to 4 to 7.5%, according to officials. Exceptions will be made for some situations, including guide dogs for the blind or foreigners moving to the U.S. with their pets. Interesting thing here, most of the dogs recently rejected came from just 3 countries. That's Russia, Ukraine, and Colombia. Many of the rejections were due to fraudulent paperwork claiming the dogs were older than 4 months. Dogs younger than 4 months aren't allowed in because rabies vaccinations don't take full effect before a dog is at that age. So, yeah, this is out of the United States, the CDC. They are basically banning dogs coming in from more than 100 different countries due to a spike in puppies and other dogs having rabies. So we'll keep an eye on that. It's a temporary ban, so we'll see when that comes off being a ban. Karachi, Pakistan. Here's a news report, and this is a place where on the website outbreaknewstoday.com we cover what's going on in Karachi with rabies cases, and we've reported several so far this year. And big problem in the Karachi area is stray dogs. And this report says, this gentleman says, "We have asked the local administration many times to initiate a culling campaign against these stray dogs, but all in vain," adding that the situation is getting worse with the passage of time. Data collected by the Indus Hospital in Karachi reveals more than 3,000 cases of dog bites were reported in the past 6 months, and 7,500 cases were registered in 2020 by that hospital alone. So far this year, Jinnah Postgraduate Medical College reported 6 deaths due to rabies, while 4 others were reported by the Indus Hospital. There is no official data available to confirm that how many stray dogs exist in the city. However, some animal rights activists claim the number to be more than 200,000. A year ago, the Sindh government began a campaign to cull the stray dogs. However, the movement had to be stopped after objections were raised by some animal rights groups. These groups suggested that instead of culling the dogs, government should spay them and control their population growth. So Karachi is a hotspot for rabies and stray dogs, according to this report. And then there's been the outbreak of rabies in Sarawak province in Malaysia. This has been going on for a couple of years now. And this, of course, is the original report from the Ministry of Health. And it's in Malay. So I went ahead and translated it onto OutbreakNewsToday.com. And this is from the 10th. The Ministry of Health Malaysia reports an additional human death of rabies among an individual in Sarawak, which was confirmed positive on May 11th. It was a 45-year-old male who lived in a house in Stapang, Selangau, Sarawak. He was admitted to the hospital on May 6th due to symptoms of fever, headache, sore throat, pain while drinking water, and hydrophobia. He had a history of being bitten on the face and on the chin, the calf and the chin by different dogs that belonged to a friend of his back in February and March. He did not wash the wounds on his calves and the chin with running water and soap for 15 minutes and never sought post-exposure prophylaxis. The owner killed the two dogs, but did not hand over the carcasses to vet services to test for rabies. So this individual was admitted to the hospital, deteriorated pretty rapidly, eventually died on May 12th, and they did do some testing on the person, the case, and rabies virus was detected, and the individual had a diagnosis of rabies encephalitis. Well, with this new case, so far the number of human rabies cases in Sarawak this year is 4. And since the rabies outbreak was declared on July 1st, 2017, so it's going on 4 years actually, in Sarawak, the number of cases has been 35 with 33 fatalities. 2 of the cases are surviving children. Yes, they survive, but they are living with severe neurological complications. And let me go ahead and close out with this. And when you hear this, you must be sitting back going, what are people thinking, right? And this is out of Denver, Colorado. And Denver Animal Protection has been busy, apparently, responding to calls in which people brought baby raccoons into their homes and played with them. And of course, this presents a serious rabies risk. People who handle the animals must go to the doctor and may have to get post-exposure rabies vaccinations. And their pets, if they were in contact with the animals, must be quarantined for at least 45 days. So they say the best thing to do if you see an animal you think may be abandoned or needs help is to report it. And they go on with a little more detail. It's important to know that young wildlife are usually not orphaned. Many species of wildlife leave their young in a safe place to look for food. It is not uncommon for baby animals to be left alone for hours. Mom is usually not far away and comes back to take care of her young. So anyway, so they're really advising people to not do this. They say, and while these babies can be cute, they can be very dangerous. So, hands off the wildlife. Wild animals account for more than 90% of reported rabies in the U.S. Rabies is a virus spread to people from the saliva of infected animals. The virus is usually transmitted through a bite, or if not treated before symptoms appear, it's deadly. Rabies has the highest mortality rate, 99.9% of any disease on Earth. So, lesson learned, do not handle wildlife. Do not handle the baby wildlife. Your rolling the dice for a very, very potentially dangerous virus. So it's wise just to leave them alone. Anyway, so that's some news that's going on with rabies in the past week or so. So we had some human deaths in Malaysia, Pakistan, Karachi, Pakistan. Human deaths, lots of stray dog bites. The CDC is banning dogs from about 120, 130 countries from coming into the U.S. And Denver Animal Protection is telling Denver residents, leave the wildlife alone. All right, well, that's all I got for you today. Thanks for listening, and I'll see you next time on Outbreak News TV.